Boobs come in all sizes and shapes. And for all of us women, they have an important place. Droopy, pointy, party balloons that come as a pair. Round, perky, saggy, even square. I love when we associate them with food. Milk jugs, melons, coconuts or juicy mangoes, over-easies, bacon hangers, gumdrops or avocados. You can call them whatever you want, to be fair. Have you got a name for your pair? Or maybe you stick to biology and simply call them your chest. During your mammogram, they're x-rayed 4 times, 2 for each breast. You'll be invited for a mammogram every 3 years from the age of 50, and your breast screening visits will end 1 year after you hit 70. But seriously, this is about how they need to be checked, and how your mammogram is something you really shouldn't neglect. Your screening's a chance to let your celeb shine. Try not to worry. You'll be fine. Time to take off your bra and let the girls out. Ready for the mammographer to tell you what the screening's all about. If you're anxious or feeling a little shy, bring a modesty scarf to have on standby. Everyone's boobs look and feel unique, so don't be embarrassed. Mammographers see over 100 pairs a week. Do not use talcum powder or spray deodorant on the day, as this could affect the mammogram, but roll-on is okay. Between 2 pieces of plastic, the X-ray machine will squeeze them. It only takes a few minutes to picture them. The mammographer will make it as quick and as comfortable as it can be. And before you know, you'll be back home, sipping a cup of tea. Don't worry about the X-rays, just a low dose of radiation. The same as you'd get on a flight to your favourite long-haul destination. Don't wait till you're 50 to check for differences or lumps. Remember to massage monthly for every new changes or bumps. Early detection is the answer for the prevention and beating of cancer. It may detect something new or nothing at all. So if you missed your appointment, go on, give them a call. 4 X-rays could save your life. A mammogram can help you get ahead in the fight.
Well, breast cancer is one of the most extensive cancers in Liverpool and in the country. More people get breast cancer than any other. So it's really important that we do as much as we can to enable people who have breast cancer to be identified as early as possible. Because we know that if it's identified early, then it can be treated more successfully. So breast screening is a simple way to identify whether there might be early changes in the breast that are caused by cancer. It involves going along to one of the breast screening units, and in Liverpool the main one is at Broad Green Hospital. So we're really keen that in Liverpool, and specifically in the Anfield, Everton region of Liverpool, people go for their breast screening. Through Liverpool and this area, there are fewer people than around the country going. And that's a real shame, because that means that some women are not getting their breast cancer diagnosed as soon as it could be, with all the implications that that has.
Like many people watching this video right now, I've witnessed breast cancer in action. Not personally, but I've watched 2 friends go through 2 very different journeys. One who diagnosed herself quite quickly. She was educated and knew the signs to look out for, and her future looks really, really exciting. Sadly, another friend of ours lost her life to cancer, and this is why I think it's so important, if you're given an opportunity to go for a mammogram, to be diagnosed at an early stage, it's life-changing. It is the difference between a few months dealing with cancer and losing your life to cancer. As a professional then, the difference between finding a lady who has stage 1 breast cancer and a lady who has stage 3 breast cancer, how important is that when it comes to dealing with it and getting it out of this lady's life?
Well, the key issue is, when do you diagnose your breast cancer? And if you can diagnose it at stage 1, we know that the likelihood is that with treatment, you're going to get better. As the breast cancer presents later and later, it's more and more difficult to treat it.
Yeah.
So diagnosing it early is what we're trying to achieve for everybody who gets breast cancer.
So breast screening is mammography, which is having x-rays taken of your breasts every 3 years. It's for women who don't have any symptoms of breast cancer, and it's for those who are not currently under care for breast cancer. When you come into the mammography room, you'll be greeted with one female mammographer and no one else will be in the room with you. So having a mammogram does require you to be undressed from the waist up. One breast goes on the mammography machine at a time, and then a clear plastic paddle is placed firmly down onto the breast. An x-ray picture is taken and it lasts just a few seconds, and that's done 4 times, twice on each side.
It's a little x-ray machine that examines the breasts. All x-rays have some radiation, and we are always cautious in the health profession to minimise that exposure as much as possible. So yes, a mammogram, the x-ray of the breast, does provide some radiation. But just remember, when you go on a flight on your holidays, you're getting some radiation in the sky. For any screening activity, there are episodes where there's a false positive. That is, something seems to be identified that could be breast cancer, but it turns out not to be, or false negatives where things are not spotted. But the good thing about mammography, about breast screening, is that both of those are very low, and it's well worth attending.
Broad Green Breast Screening Unit is fully accessible to those with mobility issues. Some women can find having a mammogram uncomfortable, but for the majority of women, it's painless. So the results will come through the post to you and your GP within 2 weeks. If you miss or forget your appointment, that's not a problem at all. You just need to phone the breast screening unit and they can rebook you.
Breast aware is just keeping your eyes open for any changes that you might notice. So those could be things like if you've noticed any changes in the skin of your breasts, if you've noticed any nipple changes, so particularly things like if you notice that your nipple is going in on itself, or if you're getting any discharge or blood from your nipple, those would be things that would prompt you to see your GP. Also, you need to make sure that you're feeling regularly for any lumps or bumps, anything that's abnormal for you, and making sure that as soon as you feel that, if it's raising concern, if it's new, that you're seeing your GP straight away. When we think about breast cancer, we think about breast lumps and examining yourself to pick up breast lumps and seeing your GP if you detect that. But in some cases, in early breast cancer, some of those lumps aren't palpable, and by being invited for breast screening, you might have a mammogram, and this might detect something early that you might otherwise not have had symptoms or felt any breast lumps with. So early detection can improve long-term survival.
So female breast cancer is the most common cancer in Liverpool, with 1 in 7 women being diagnosed sometime in their lifetime. Breast screening uses an x-ray called a mammogram. It can detect cancer before anything can be felt or seen when being examined externally. So the take-up in Liverpool is lower than the national average, with people not attending appointments to be screened. This is really concerning.
For women who have special needs or learning disabilities, when they get their letter to be invited for breast screening, they can contact Broad Green Hospital. They can ask for a pre-visit, which is, and they can have that visit with a family member or a friend. They can also ask for a longer appointment. But I think the most important message that we have is that if you do miss your appointment or you forget about your appointment, you can contact or email Broad Green, and an appointment will be rearranged for you. So when we talk about being breast aware, what are we talking about?
We're talking about breast cancer.
Okay, do we do anything to our boobs?
Yes, we check, look and feel and rub around and make sure that if we find a lump, we go to our doctors and ask them, and then we'll get a letter to say to go for a mammogram at Broad Green Hospital.
The breast screening, the mammography, as it's called technically, which again is just a technical name for an X-ray, can pick up disease in the breast that we can't pick up clinically in our examinations. And this means we can diagnose cancers early, but more importantly, we can treat these cancers a lot earlier, and therefore, in many cases, cure the disease before it progresses. Yes, the screening is targeted at the 50 plus age group, and this is because the majority of breast cancers, 80% plus, are in the over 50 age group, and of course the incidence of breast cancer increases with age. But also there are technical difficulties in performing the screening below this age due to differences in breast density, and therefore it is much more suitable for people over the age of 50. Particularly in this area, in Liverpool, breast cancer is the biggest cause of cancer in women, and if undiagnosed and diagnosed late, can obviously have catastrophic consequences. We know that the screening is simple, painless and effective, and if we pick up these cancers early, it's very treatable. So that's why I really encourage all my patients to attend.
So breast screening is where they use a breast X-ray called a mammogram. This is where we look for cancer that may be too small to see or to feel. The earlier we detect breast cancer, the more successful and likely the treatment is to work. A mammogram doesn't hurt. It may be a little bit uncomfortable, and if it does feel painful, you can ask the radiographer not to squeeze down on your breast too tightly onto the X-ray plate. Most women will receive a letter telling them that they have found no signs of cancer. It's important that we go and get our breast screening done. It's important so that we can detect any signs of cancer so that we can stay fit, healthy and well.
If you've been lucky enough to receive a letter in the post inviting you for your mammogram and you've sat back and thought about it too long, maybe the appointment's passed, don't worry about it, you can rebook straight away. Don't think for a minute you have to wait 3 years to be called up again. No, you can call your GP, you can book in with any signs, any concerns you might have, speak to someone, and more importantly, if you've had a request for you to turn up for a mammogram, you can rebook at any time, and there's no time like the present. Do it today.